Good afternoon and welcome. It's kind of nice to be just right behind Kay and Linda as the person with the most hair up here, or number 3 person with the most hair up here for the afternoon session. Most recently, over the last this summer, I was the interim director for the Center for Health Statistics. So I know the folks that are going to present to you fairly well. I've worked for them over the last 3 years. But what we wanted to do was just remind you of our website that we'll be using in a little while. If everybody will write that down real quick, we can come back to it. Yeah, it'll be up. Okay. Anyway, our goal today is to improve the ability of local health departments to collect and manage data for the community health assessment. And our objectives today are to list multiple types of data that inform a community health assessment, to cite national, state, and local sources that provide data for community health assessments, to analyze and organize the information available in small, medium, and large local health department settings, and to prioritize the data to be used in the community health assessment. And each one of the individuals that are here for me today are going to take a different piece of that. But first, we wanted to step back. Many of you may have been here a year ago at the Accreditation conference, the first conference that we put on. And some of the speakers at that conference reminded us of different types of common elements to a community health assessment. So just tips to remember: develop an assessment plan. Always engage the community and local health system partners that will help you define your population, to prioritize the things you're going to look for, and to identify community health status indicators, looking at morbidity, mortality, and things like that. Additionally, you should be collecting data on the identified community health status indicators, and then have some type of analytics with the data, summarize the key findings, and then report back to your partners and your stakeholders and all of those in the public health system. Some characteristics of the data profile that you'll be looking at are those health status indicators of the population, the priorities that your stakeholders and partners have helped you establish, determinants of health in your community. Access and resources are always, of course, at the top of the list. You'll need to look at health disparities and health outcomes. So with that kind of as an opening to the things that we discussed at our prior conference, let's move on to today and move forward into the accreditation process and see if we can find better ways and more tools to help local health departments with their community health assessment and their community health improvement plan. With us this afternoon, our first speaker will be Michelle Cook. Michelle is an epidemiologist with the Department of State Health Services and the BRFSS coordinator. She's been a BRFSS coordinator in 2 different states. She graduated with a bachelor's in biology from the University of Massachusetts, Dartmouth, earned her master's in public health and epidemiology from State University of New York at Albany, and is currently a doctoral candidate at the University of Texas with a focus on behavioral epidemiology. Ann Barnett is our GS team lead in the Center for Health Statistics. Ann is responsible for the administration and direction of all geographic analysts and cartographic resources created by the Center for Health Statistics in support of the Department of State Health Services, as well as other HHSC enterprise departments. Her experience in the GIS field includes work for state government, private industry, and education. Prior to joining DSHS 6 years ago, she worked as a GIS trainer and a research assistant. She holds a Master's of Science degree in GIS, Geography and Natural Resource, and Recreation Development from Texas A&M University. Christopher Webb will actually take us through an exercise. Those of you that have your laptops and can get in on the Wi-Fi, we'll take you through a couple of 2 or 3 exercises and actually locating data and seeing what we can do with the data. Chris is a research specialist for the Center of Health Statistics. Since 2007, he's been working on disseminating and demographic, economic, and population data. He also gives an annual class on utilizing the Census American Community Survey and health research. He has a Master's of Public Health from the UT Health Science Center, Houston School of Public Health, and an undergraduate degree from Georgia Tech in Public Policy. Also with us today, we brought one of our other experts in our data management team, Janice Jackson, who is a program specialist in the Center for Health Statistics. She's been working with vital statistics data in the center since 2005. She's also worked in other areas of the department, including geographic information systems, disease control and prevention, and in the DSHS lab. Prior to that, she worked at the University of Texas School of Public Health in Houston and at the University of Texas at Austin. She also has a master's in public health from the University of Texas School of Public Health in Houston. So we have a very dedicated and very qualified panel to discuss the issues that we are going to discuss with you this afternoon. And so without any further remarks, I'd like to bring Michelle Cook up. Michelle?